Thank you, Professor Baker, for your very, very nice, very interesting story, and also Dr. Roth. Thank you very much. And I also want to like to thank the CPB for organizing this lecture, because it's a very crucial topic and subject. And thank you for inviting me to add my perspective on this matter, which is the perspective of a policymaker, for the Dutch government, of course. The Oregon experiment is a unique experiment from the US with important findings and lessons. And first and foremost, it shows us the importance of having a health insurance. And thankfully, here in the Netherlands, almost nearly every resident is insured. And the experiment also shows that by improving collective coverage, healthcare utilization goes up. And it shows that improving healthcare coverage has important additional benefits. It will improve access to preventive services, improve overall well-being, decrease depression, and reduce financial strain. And the CPB study presented today provides us with an assessment of the current state of a risk and income solidarity in our system. And these are two important pillars of our system. This study gives us an important baseline for the future research into how current policies to improve access to healthcare affect risk and income solidarity. And this study shows that the risk solidarity in the Dutch healthcare is currently high. Income solidarity is relatively low compared to some other countries. But as the CPB report states, we expect income solidarity to improve when we substantially lower the mandatory deductible in 2027. The current level of the deductible of €358 may create a financial threshold which is too high for some people. And this may cause people to postpone medically necessary care. And research does show that there has been an increase in the number of people foregoing care for financial reasons. And I'm particularly concerned about the financial accessibility of care for people who need a lot of care and people with care needs of difficulties to ends meet. So I'm glad that the proposed policy changes are a step towards improving income solidarity. And at the same time, we all know that the demand for the healthcare may increase when the level of the deductible decreases. And people are likely to go to the doctor more often and sooner. And our healthcare is already under pressure. In the Netherlands, we are getting older and older, and that's great. But it does mean that we need more care for our elderly. And looking into the future, the demand for care, as you all know, is exploding. Healthcare expenditure at the national level keeps rising, and yet some individuals already face difficulties in paying their healthcare bills. And at the same time, 1 in 6 people work in the health and welfare sector already. And if you don't change anything, that figure is predicted to increase in 1 in 3 in 2060. And that is unsustainable, even today. And it shows just how important it is that we improve our system and prepare for the challenges that lie ahead of us. And to understand the challenges we face in the Netherlands, it's important to focus on the broader picture and to look beyond only insurance design, cost-sharing options, and cost containment. I believe it's time for a cultural change in healthcare and policymaking. By cultural change, I mean that I think that we should more often ask ourselves the question, what does a person really need? Is it medical care that she needs? Or would people benefit much more from something else? For example, we know that loneliness, illiteracy, and debt can have a big impact on a person's health. And I think that should be the new standard in healthcare. Looking at what a person really needs and looking beyond the medical care domain and focusing on what we can do to improve a person's quality of life and add value to it. To illustrate this point, let's take you to Heerlen, you all know, a municipality in the south of the Netherlands. And this municipality and the entire region ranks at the bottom in almost all health, lifestyle, and mental indicators. A relatively share of Heerlen's inhabitants experience stress, are at risk of an anxiety disorder, of depression, and express the view that they have little control of their own lives. They more often feel lonely and they have lower levels of health insurance, of literacy. This applies to adults, but it partly applies already to younger people too. And Heerlen is also an area in which it's hard to find enough doctors and other healthcare professionals. And there's a big gap between the increasing demand for care and the supply of care offered in the region. And to sum it up, Heerlen is a place with plenty of challenges in terms of organizing healthcare. But it's also the place where there's a movement to organize healthcare in a different way, and a cultural change is underway. For example, in Heerlen, a social hospital is going to be created, in which inhabitants of Heerlen with complex and multi-phase problems receive targeted and multidisciplinary support, not just from healthcare professionals, but also from social workers and financial advisors, among others. And this approach underlines the importance of really taking time to listen to inhabitants and their needs, as well as other stakeholders. The social hospital in Heerlen is going to be created by citizens, municipalities, healthcare professionals together, because they realize that what people need is not just only medical care, but rather help with financial matters and debt, for example. And in my opinion, Heerlen is an example for the rest of our country. And I'm glad that there are many more great examples of places where healthcare is organized in a different way. The province of Zeeland is a frontrunner, for example, but also Mooi Maasvallei in North Brabant. And in those places, the cultural change I mentioned before has taken place. They look beyond the domain of medical care and start from what the person really needs, what they can do to improve a person's quality of life and how they can add value to it. And when I speak with general practitioners from this region, they tell me that half of their patients actually have needs for social care, not medical care. General practitioners are now referring their patients to social care workers instead of hospitals. And they're also investing in a person's social basis to improve their mental health, and this reduces the demand for mental health care. I think that with this different perspective, you'll find a lot of the healthcare which is currently provided will turn out to be unnecessary, and that cultural change is the best way to go forward. And let me conclude. Our healthcare system is great, and at the same time it faces severe challenges. Professor Baker has already said that to address these challenges, we should focus on increasing value, not solely on slowing down expenditure growth. And I fully agree with her. Our main focus is to improve value and to improve accessibility of care. And we need a cultural change to achieve this. That is why we made the so-called Integraal Zorgakkoord, together with the Dutch healthcare sector. And we are currently working on broadening this agreement by including stakeholders beyond the medical domain. And we are working towards an integral agreement on healthcare and welfare. And of course, we need tools like cost sharing, and we need to think about the coverage and the basic benefit package. But I strongly believe that cultural and behavioral measures are needed as well, if we are going to curb the growth in demand for healthcare and tackle low-value care. So we need to keep on looking for innovative ways to increase value and to keep our healthcare accessible for everyone. We should work together with citizens, municipalities, healthcare professionals, social workers, and so on, to make sure we'll do what the person really needs. We should work for a healthcare system where it doesn't matter where you were born, what your education is, or how rich you are. We should work for a system where good care is available for everyone. Thank you very much.
Thank you so much.